In this video, we'll be uncovering the latest findings on the diverse roles of vitamin D that go beyond just keeping our bones strong. From supporting the immune system to potential impacts on mental health, cardiovascular health, and more, there's a lot to explore. So, buckle up as we journey into the intriguing and evolving landscape of vitamin D research. But before we dive in, make sure to hit that subscribe button, give us a thumbs up, and ring the notification bell so you never miss out on our latest content. Now, let's shed some light on the newly discovered roles of vitamin D. Research on the role of vitamin D in disease prevention has garnered considerable attention, with a focus on determining the efficacy of doses exceeding the Recommended Dietary Allowance, RDA. While observational studies highlight a notable correlation between reduced disease rates in populations residing in sunnier regions or exhibiting higher vitamin D serum levels, the outcomes of clinical trials administering vitamin D supplements to target specific diseases remain inconclusive. Vitamin D and bone and muscle strength. A comprehensive meta-analysis involving 12 randomized controlled trials, encompassing over 42,000 individuals aged 65 and above, predominantly women, scrutinized the impact of vitamin D supplementation with or without calcium. The analysis revealed that higher vitamin D intake, approximately 500 to 800 IU per day, reduced hip and non-spine fractures by approximately 20%. In contrast, lower intakes, 400 IU or less, failed to exhibit any discernible fracture prevention benefits. Beyond its role in bone health, vitamin D is implicated in enhancing muscle strength by preserving muscle fibers, a factor crucial in preventing falls, common occurrences leading to substantial disability and mortality among older individuals. A pooled analysis of multiple studies indicated that a daily intake of 700 to 1,000 IU of vitamin D lowered the risk of falls by 19%, whereas doses ranging from 200 to 600 IU did not offer such protection. Vitamin D and cancer. Geographic location, particularly latitude, has been linked to colon cancer mortality rates, with higher latitudes showing increased death rates. The connection is attributed to lower vitamin D levels due to weaker UVB rays at higher latitudes. Vitamin D has been studied for its potential to inhibit tumor development, especially in organs like the colon. While epidemiological studies support the idea that higher vitamin D levels are associated with lower cancer rates, clinical trials like the Women's Health Initiative and VITAL have not consistently confirmed these associations. VITAL did not find significantly different cancer rates between those taking vitamin D and the placebo group but suggested a potential survival benefit for those with higher vitamin D status, as seen in reduced cancer-related mortality over time. The evidence indicates that while vitamin D may not be a primary factor in preventing cancer, it could enhance survival in individuals who develop cancer. Vitamin D and type 2 diabetes. The impact of vitamin D deficiency on the biochemical pathways leading to the development of type 2 diabetes, T2DM, is a subject of concern, affecting beta cell function in the pancreas, insulin resistance, and inflammation. Observational studies have highlighted an inverse relationship between higher vitamin D blood levels and the incidence of T2DM. In a comprehensive analysis of the Nurses' Health Study, involving over 83,000 women without diabetes at baseline, the association between vitamin D and calcium intakes and the development of T2DM was explored over a 20-year period. Women with the highest vitamin D intake from supplements demonstrated a 13% lower risk of developing T2DM compared to those with the lowest intake. The protective effect was even more pronounced when vitamin D was combined with calcium. Vitamin D and immune system. Vitamin D's involvement in immune system regulation has prompted researchers to delve into two interconnected research avenues. First, they explore whether vitamin D deficiency contributes to the onset of autoimmune diseases like multiple sclerosis and type 1 diabetes, where the immune system erroneously attacks the body's own organs and tissues. Second, scientists investigate whether vitamin D supplements could enhance the body's immune defenses to combat infectious diseases, such as tuberculosis and seasonal flu. Multiple sclerosis. The incidence of multiple sclerosis, MS, is on the rise globally, and while the precise cause remains unclear, a combination of genetic predisposition and environmental factors, including insufficient vitamin D and UVB exposure, has been identified as increasing the risk. Over 4 decades ago, vitamin D was first proposed as a potential factor in MS development, spurred by observations that MS rates were notably higher at latitudes far from the equator and lower in regions with diets rich in fish. In a prospective study focusing on dietary vitamin D intake, women with a daily intake above 400 IU exhibited a 40% lower risk of developing MS. Similarly, a study among healthy young adults in the U.S. found that white individuals with the highest vitamin D serum levels had a 62% lower risk of developing MS compared to those with the lowest levels. Notably, this effect was not observed in black participants, possibly due to lower vitamin D levels and fewer black study participants. Additional prospective studies conducted in Sweden and Finland revealed a 61% lower risk of MS with higher serum vitamin D levels and a 43% increased risk of MS with low serum vitamin D levels, respectively, among young adults. In individuals already diagnosed with MS, higher vitamin D levels have been associated with reduced disease activity and progression. Cumulatively, the existing evidence strongly suggests that low vitamin D levels may play a causal role in MS. If this is indeed the case, correcting vitamin D insufficiency could potentially prevent around 40% of MS cases. Recent findings indicating that genetically determined low vitamin D levels predict a higher risk of multiple sclerosis further strengthen the connection between vitamin D and the development of this autoimmune disease. Seasonal flu and vitamin D. The seasonality of flu outbreaks, peaking in winter and subsiding in summer, prompted a hypothesis by a British doctor suggesting a sunlight-related seasonal stimulus as a trigger for influenza. Over 20 years later, scientists proposed that vitamin D might be the key seasonal stimulus. Among the evidence supporting this hypothesis, vitamin D levels are lowest in the winter months. The active form of vitamin D tempers the damaging inflammatory response of some white blood cells, while it also boosts immune cells' production of microbe-fighting proteins. Children who have vitamin D deficiency rickets are more likely to get respiratory infections, while children exposed to sunlight seem to have fewer respiratory infections. Adults who have low vitamin D levels are more likely to report having had a recent cough, cold, or upper respiratory tract infection. A randomized controlled trial conducted in Japanese schoolchildren aimed to investigate whether daily vitamin D supplements could prevent seasonal flu. The trial followed nearly 340 children over 4 months during the peak of the winter flu season. Half of the participants received pills containing 1,200 IU of vitamin D, while the other half received placebo pills. The researchers observed that the rate of type A influenza in the vitamin D group was approximately 40% lower than in the placebo group, with no significant difference in type B influenza rates. While other randomized controlled trials exploring the potential of vitamin D in preventing various acute respiratory infections have yielded mixed results, a comprehensive meta-analysis of individual participant data indicated that daily or weekly vitamin D supplementation can reduce the risk of acute respiratory infections. This effect was particularly notable for individuals with very deficient vitamin D levels. The findings from this meta-analysis have prompted consideration of the potential role of low vitamin D levels in increasing the risk or severity of novel coronavirus 2019, COVID-19, infection. Although there is no direct evidence due to the novelty of the disease, maintaining adequate vitamin D levels is recommended for various reasons. Individuals with darker skin or limited sun exposure, who may be at risk of lower vitamin D levels, are advised to consider a supplement of 1,000 or 2,000 IU per day. This dosage is now included in many standard multiple vitamin supplements and is cost-effective. It's important to note that more research is needed before definitively concluding that vitamin D protects against the flu and other acute respiratory infections. Even if vitamin D provides some benefits, it should not be a substitute for getting a flu shot. Additionally, for limiting the risk of COVID-19, adhering to careful social distancing and practicing thorough hand hygiene remains crucial. Vitamin D and type 1 diabetes. Type 1 diabetes, T1D, displays significant geographic variability, with a child in Finland being around 400 times more likely to develop T1D than a child in Venezuela. While genetic factors likely contribute to this variation, some studies suggest that T1D rates are lower in sunnier regions. Early evidence hinting at a potential role of vitamin D in T1D comes from a 30-year study in Finland that monitored over 10,000 children from birth. The study found that children who regularly received vitamin D supplements during infancy had a nearly 90% lower risk of developing type 1 diabetes compared to those who did not receive supplements. However, research exploring the association between dietary vitamin D and T1D, as well as trials supplementing children at high risk for T1D with vitamin D, has produced mixed and inconclusive results. Approximately 40% of T1D cases initiate in adulthood, but as of now, no randomized controlled trials specifically examining vitamin D and adult-onset T1D have been conducted. The feasibility of such trials remains uncertain, and further research is needed in this area to provide more conclusive insights into the potential link between vitamin D and the development of type 1 diabetes in adulthood. Tuberculosis. Historically, before the era of antibiotics, sunlight and sun lamps were integral components of the standard treatment for tuberculosis, TB. More recent research has explored the potential link between the sunshine vitamin, vitamin D, and the risk of TB. Several case control studies, when collectively analyzed, suggest that individuals diagnosed with tuberculosis tend to have lower vitamin D levels compared to healthy individuals of similar age and other characteristics. Other autoimmune disease. The vitamin D and omega-3 trial, VITAL, a randomized double-blind placebo-controlled trial tracking over 25,000 men and women aged 50 and older, revealed noteworthy findings regarding vitamin D supplementation. The trial showed that taking vitamin D supplements at a dosage of 2,000 IU/day for 5 years, either alone or in combination with marine omega-3 fatty acids, 1,000 mg per day, led to a reduction in the incidence of autoimmune diseases by approximately 22% compared to a placebo. The autoimmune conditions observed included rheumatoid arthritis, psoriasis, polymyalgia rheumatica, and autoimmune thyroid diseases such as Hashimoto's thyroiditis and Graves' disease. The doses administered in these supplements are readily available and generally well tolerated. The outcomes of the VITAL trial suggest a potential benefit of vitamin D supplementation in mitigating the risk of various autoimmune conditions. However, the authors emphasized the need for additional trials to further assess the effectiveness of these supplements and to confirm the observed reductions in autoimmune disease incidence. This research contributes valuable insights into the potential role of vitamin D in modulating the immune system and its impact on autoimmune conditions, encouraging further exploration in this area. Reduction in overall mortality. A compelling report in the Archives of Internal Medicine suggests that vitamin D supplementation may reduce overall mortality rates. A combined analysis of multiple studies, encompassing data from 18 randomized controlled trials with nearly 60,000 participants, indicated a statistically significant 7% reduction in mortality from any cause with modest levels of vitamin D supplements. The majority of participants took between 400 and 800 IU of vitamin D per day for an average of 5 years. Vitamin D and cognitive functions. In an analysis involving over 427,000 white European participants using Mendelian randomization, it was found that individuals with low vitamin D blood had a 54% higher risk of dementia compared to those with adequate levels. This approach, which employs genetic variations to establish causal relationships, helps provide robust evidence linking low vitamin D levels to an increased risk of cognitive decline and dementia. The findings underscore the potential importance of maintaining sufficient vitamin D levels for cognitive health. Thank you for watching this video. Please subscribe our channel for more videos.